Okay. All right, Austin. So you have a lateral ankle sprain. So I just wanted to go over the goals that I have for you really quick. First off, any allergies or anything to Tylenol or okay. So what I want to do is put you on a leaf. Do you have any in your room? Okay. So we'll get you started today with a dose for the morning and for the night. So you'll take 2 at night and 2 in the morning. We'll really stay on that. It's going to help with some of the inflammation you got going on. Drink it with food, or drink with food, water, but twice daily. So 2 in the morning, 2 at night. And then what I really want to focus on as well. So you're lacking a little bit of range of motion, a little bit of strength. So one of our big goals for this week is going to be really working on strengthening up the ankle. So we'll do things like TheraBands. We'll do some calf raises, and then really increase your range of motion. Okay. And then just some things like proprioception, some balance stuff. So we'll work on single leg balance on the foam pad. Throughout this whole thing, though, we don't want this to be painful. Okay, so I'm okay with working with discomfort. So if you start to feel anything or you feel it, but it's not painful, that's good. The moment it starts to become painful, we're going to shut down and we're just going to drop back to something easier. Do you have any questions?
When do you think I'll be back?
Okay. Right now, I'm going to look at it on like a week-to-week basis. So let's look at the end of the week, kind of where you're at with strength and range of motion. Those are my 2 biggest things. So we can reevaluate and talk again. What I want to do is kind of every couple of days or at the end of the week, we'll talk about what your goals are. So I told you my goals. I want to increase range of motion and strength. What are your own goals for this?
I want it to be less painful.
Okay. Yeah.
Take away the pain a little bit.
Okay. Which is good. So what we'll do as well is a little bit of cryotherapy. So we're going to do some ice. We can do game ready before our treatment, and we can do ice bags after. We can do vice versa, however you want to do it. But for this first week, since it just happened, we're going to really focus on ice. And so whatever your preference is kind of thing. Have you been on game ready before? No? Okay. So we'll get you on game ready. If you do ice at home, which is great, ice at home, elevate. So prop your leg up on a pillow or something like that. Any other questions? Kind of what we have going on for the week?
No.
All right. Well, then we'll start with some rehab today, and then we'll keep going throughout the week and start progressing some of those things. Okay.